simple. So my name is Dr. Ogden, and I am here with Reta. And would you like to introduce yourself?
Yeah, my name is Brandie Yoder. I am the CEO here at Reta.
Okay, and so kind of tell us, what is Reta, and kind of what your mission is for the county and for probably wherever it wants to reach.
Yeah, so Reta has been in Elkhart County for 40 years. We're a no-cost pregnancy clinic and family resource center. And we offer like 4 main buckets of service. So the first one is our medical services. We do pregnancy tests, ultrasounds, STD testing and treatment, and we do some OB care as well, and then get them transferred on, and have a community health program. And so we want our moms who are with us during pregnancy to feel supported as they transition into parenthood, because that comes with a whole host of things. Another pillar that we offer is our mental health services. So we have a licensed mental health counselor and a clinical psychologist on staff. So we do no-cost mental health services, and they're top quality.
So no insurance, even if they don't have insurance or anything, they can still come here.
They can still come. We do more stabilization therapy, so it's about 10 to 12 sessions. We're not, doing 2 years of therapy with people, but we will refer them on.
Yeah.
But we're helping them get through a crisis. And then they may, learn a skill set, and then later they may need to come back for another situation that they're dealing with, and that's okay. And then our mentoring services, this is the largest that we offer. We have one-on-one mentors. So right now we have over 70 mentors who are volunteering their time here.
Wow, that's amazing.
It is amazing. And we ask for a year commitment. They meet with their mentees once a week, and they do life together. So there's no set curriculum where you have to check off these goals. It's very much driven by what is the mentee experiencing, what do they want to accomplish, and then helping them navigate to that. And they'll go to baby showers.
I was going to say, so it's like you're really doing life with them. Whatever they need, you're there.
And a lot of our moms, they didn't have good role models growing up. And so to have, a mentor who is, a lot of our mentors are moms or grandmas, who can come alongside and just be that guidance that isn't telling you how to do things, but just encouraging you along the way.
Or been like, I've been there, I've done that, or something along those lines. Yeah. So how did you get started with Reta? That is something I want to introduce you personally, just because there's been a little bit of changing roles in the past couple of years. And, how did you, get your position, things like that as well?
Yes. So Reta has been near and dear to my heart and my family's heart for a long time. I had an aunt who volunteered here years ago. She has since actually passed away.
Okay, I'm so sorry to hear that.
Thank you. So we've gone to the banquets for years, and I love what Reta stands for and does in our community. I'm actually a nurse. My background is in nursing, so I did that for many years. And I actually got into a position where I started to do case management in the community and started to see all of the things that were factoring into people's health that were social. So what they experienced as a child, the things that they're experiencing currently in their life, and how that was impacting their choices and really, their overall health. And so that led me down a path to getting out of the traditional healthcare setting and getting into the nonprofit sector. So I actually started here as the clinic director.
Really? Okay, yes. I did not know that.
Yeah,
okay.
So I clinic director, and I was starting the community health nurse program. And then when my friend, who was our previous CEO, left due to her son's health condition, it just felt like an opportunity to step in and lead an organization that I could not love what we do more. Just to be able, there's no judgment, no shame. Anyone who walks through our doors, we believe that you are meant to be here. And we want people to feel seen and valued and loved. And so I think for me personally, I feel our journey is on fostering, and then we did adopt through foster care. I see it in my home every day, and I see the impacts of what people have experienced and how that leads to their belief system and their behaviors, and and just how it impacts them as they're growing as a child and into adulthood.
Especially with me being adopted, I definitely understand that. I definitely can say yes, yeah. With what you guys are doing now, and I will say I would love to take maybe a picture or two. I know you guys redid a lot. So there's a lot that you guys have to offer. Because when I was here last year, you guys didn't have an awesome, I'm just going to explain it like McDonald's Playland here for the kids to play at. Or different, counseling sessions, rooms where, the families can go into privately. I love how everything's very private. It's open for obviously the kids to come with the parent and things like that. Is there anything else that you guys offer for the community? Or one of the big questions is, how can we help? I'm coming in from I'm not saying coming in from off the streets, but coming in as, I love my community and I love what you guys do. And so how can the people that see this video or, even hear it or read about it, how can they help you? And I will bring this up too, as we're going to talk about this, which is something that's coming up in December.
Yes.
But I'll let you give the overall, and at the very end, we can talk about how to help for the presents and Christmas and things like that. So
sure, yeah. So the other pillar that we have is our resources. And so we have our family store downstairs. So we have clothing from infant all the way through adults.
Okay.
And so helping to stock our family store is a huge need.
Is that open for mothers and families to come anytime, throughout the day?
Yeah, so anyone who's engaged in services can shop every week.
Okay.
They can take up to 3 items, and then, again, next week they can get their 3 items. They don't have to earn any points. We do carry bigger items like car seats and pack and plays and things like that are safety needs for our families.
Yes.
And so those are always really helpful to have the community support in helping provide those. We do diapers and wipes and formula, which is extremely expensive.
Yes, it is. I don't have a cut myself, but my friends do, and yeah, it's very expensive.
It's crazy to me. My kids are older now, and I look back and I'm like, it was not this expensive. Baby food, and then hygiene needs are really popular, and cleaning supplies. A lot of the local food pantries don't carry cleaning supplies.
Okay.
So
how do they do that? How would someone say I have some formula and some cleaning products? How would we call you? Would we say, this is go just drop it off here, or how does that happen?
You can stop in anytime we're open.
Okay.
So Monday through Thursday we're here 9 to 4, and then Friday 9 to 12.
Okay.
So you can come in anytime and just drop it off, and we'll use it in our store. We also do with our classes. So we offer 17 classes as well.
Oh my gosh.
Parenting classes, finance classes.
I might need some of those. I can see myself.
I know, right? Yes. We have classes for addictions, classes for domestic violence. We partner with a lot of people in the community who are content experts in those areas and can come in and help teach us. So some we teach internally, and then others we partner. But with our classes that happen over meals, we do a meal together. So we break bread and we enjoy fellowship over a meal.
I love that.
Yes. So 9x13 casseroles that we can stick in the freezer and pull out for our classes is a huge gift. So those are some of the, kind of one time I can do something and drop it in. And then we have our mentoring as well. That would be
the mentorship program. How does one become a mentor? Do they have to, apply online, call, or how does that work?
Yeah, so we have an online inquiry, or you can call, and then we'll give you our volunteer application.
Okay.
Everybody goes through a background check, and then we will sit down with our director of program operations or one of our staff members and just get to know you better.
Yeah.
We certainly want people who are able to come in and meet people where they are without that judgment. And so it's really important that we find people who align with our values. But then once you are, go through all the application process and your background check, then we do a training.
Okay.
So we certainly support our mentors along the way. We have quarterly trainings that are offered as well. And then every week we're checking in with our mentors to see what they need. So we also have a community resource navigator who is a social worker, and she's helping find resources for our mentees and our clients. So yeah, if you run into someone who's struggling with housing or transportation or wants to find a job, we've got someone who can assist with those things.
Okay. So this is something they are offering. I'll let you talk a little bit more about it and how us as a community can help, especially with Christmas coming up.
Yes.
So if you want to explain kind of like what this is and
yes.
how I would do this if I were to walk in here or something like that, or, you know, a little bit about this. So
yeah. So I have to go back to the beginning of the stockings.
Yes.
So a couple years ago, we had people would just buy gifts and they would bring them in and we'd set them up here and our moms would shop.
Like a Toys for Tots type thing?
Yes, very much.
Yeah.
So, which was wonderful.
Yes.
Last year, one of our staff had the idea of what if we went shopping with our moms? So they can actually pick out the gifts and wrap them and know what's under the tree and feel like they had the dignity to purchase those for their kids in a way.
I love that.
Yeah, so that's where the stocking was born from. So what happens is you get a card here and it'll say the mom's name or the kid's name and their age, and then you will fill the stocking with like 4 to 5 stocking stuffers that are appropriate for that individual. And then you put in your Walmart gift card. So
I love how you have a little card holder right there.
I know, it's some really talented staff members.
That took 3 days to do for all of them.
They were so amazing. So then once everything comes back, the first 2 weeks of December, we actually load into 15-passenger vans and we go to Walmart and go shopping.
Okay. So if you want to shop at Walmart, do not go to Walmart.
At the first 2 weeks of December.
Yeah. I don't like to go to Walmart anyway. It's so busy, but yes.
Yes, we have so much fun. And our moms, like, not only are we giving them the opportunity to shop for their kids, we're teaching them some budgeting because there's a $50 limit. So sometimes they'll pick things up and then we'll go down the next aisle and they'll have to decide, like, do I want this or do I want to, you know, keep what I have? And so that's really helpful for them to learn how to go in and shop and different things like that.
I think it's helpful for everybody too.
Right.
Yeah.
Right. And then they bring all their gifts back here. We store them so that they're not trying to hide them at home.
Okay.
And then about the third week of December, this place erupts into wrapping paper and wassail and fudge and all the things.
So much fun.
Christmas activities. So the kids can be in one room doing their stuff and moms are in wrapping their gifts. And then they get to leave with their wrapped gifts and put them under their tree or whatever they have.
Is there like a date when this ends? Like, is there like a deadline? What is that deadline?
Yeah, so we really like this stuff back by the end of November, 1st of December, so that we have it all ready to go when we start shopping.
Okay, so we have about a week away.
Yeah.
Okay.
Yeah, so our community has shown up. So the request was for 361 stockings, and we are just a few away. Like, it's
okay, so maybe people seeing this, and I'll make sure I get it ready tonight, could be the ones to show that.
Yeah.
Or if not, are you guys, is this going to be a yearly thing that you guys will do?
It's a yearly thing.
Okay.
So if they see it this year and they're like, let's think about this next year, they can let us know if their business wants to take however many, we can put that on the docket for next year. Because I can't tell you, when these moms come back from shopping, it is so fun. They are like, let me show you the gifts, and they're pulling them out.
That's fun.
So,
okay, really is there anything else you think that people seeing this or just hearing about it you'd want them to know, or just anything about, the program in general, or even any moms that might be seeing this and they had no idea this was even a program, or that how do they come here, or maybe if they're scared to, like you said, I know you guys offer a lot of different things and I think that's very important. Is there anything, would it just be like more online, or anything you would want to add like for that?
So they can reach out online or they can call us.
Okay.
And what we do is we start with an intake appointment. So if they're coming in for anything other than medical, like a pregnancy test or what, medical service, then we start with an intake appointment and just get to know them and kind of see, okay, what would be the best way to plug them in? Is that with our therapist, or is that with a class? Is it with one-on-one mentor? And we go from there. So the biggest thing that I think I want people to know is you don't have to be pregnant to come to Reta. We, primarily serve those who are pregnant and who are currently raising children. That's really where we feel like we have the most to offer. But we have men's programming as well. So I will often say to men, like, why don't you come to Reta? And they're like, I'm not a woman.
I'm not pregnant. Yeah.
I was like, you don't have to be either one of those things. So we want to see the family unit strengthened.
That's amazing.
And so that takes support at all levels. So.
Okay. Well, thank you so much for meeting with me and sharing all this information. There's some information that I didn't even know last year that I know this year. So thank you so much for your time.
Yes.
And yeah.
Thank you for helping us get the word out.